Hi, my name's Andy. I'm currently a PhD student at the University of Kent in the UK, and my current research is focused on structured illumination endomicroscopy. So I hope this video will introduce why we need endomicroscopy at all, and what some of the drawbacks of current endomicroscopy systems are, and then why we really need mosaicking, and how nice, crisp, clear images can lead to better mosaics, and that can translate into more reliable images for clinicians. So what you have here is a piece of fluorescently stained lens paper and a 1 millimeter probe. And you're going to put that probe in contact with the lens paper and then slide it across. In the upper left-hand corner, you can see the individual images, and on the right-hand side, you can see what's known as a mosaic, where individually acquired images are stitched together. And there's a few different ways you can go about that. Some will lead to more faithful representations of a ground truth, and some will have errors, and that's a discussion for another video. So I think it's important to first look at what endomicroscopy is meant to replace. Conventionally, when a clinician thinks you have either esophageal cancer or skin cancer or GI tract cysts, what they might do is they might take an endoscopy. Now, an endoscopy is useful, but it doesn't have microscopic resolution. So what the clinician needs to do is remove the tissue, freeze the tissue, slice it, stain it, and then inspect it under a microscope. So this process has a couple of costs associated with it, one being time. The amount of time it takes to remove the tissue, freeze it, slice it, and stain it usually means that patients need follow-up visits. That also has costs. I mean, there's labor costs associated with that extra time and multiple specialists. So yeah, the next is labor. Usually the person removing the tissue isn't the one freezing it, slicing it, or examining it under a microscope. Another is equipment. Relatively expensive microscopes, staining equipment, and alongside equipment really goes facilities. All this stuff takes a big infrastructure to support it, and it would be easier if it could be done on the spot with a lower cost bedside system. So endomicroscopy is really meant to be that bedside system. Major benefits are systems can be made portable. It can give you an on-the-spot diagnosis, going straight from diagnosis and treatment in the same setting. It can be useful for interoperative surgical guidance, and this is with any organ that's accessible, like skin or mouth. Or hollow, like the GI tract, esophagus, lungs, or surgically accessible, like keyhole heart surgery and stuff like that. There's minimal specialists required. The person who is doing the endoscopy can be trained to interpret the images. And there's been some recent work in using machine learning to aid clinicians in making a decision. And all of this really, the big benefit is you have a time saving to the NHS or to the healthcare provider. You need fewer specialists, and you can go straight from diagnosis to treatment, so fewer follow-up visits. Now, there are drawbacks to the current commercial systems. There's two commercial systems on the market right now, the Mauna Kea Cellvizio and the Optiscan 5.2. Both of these systems use lasers, and they're scanning systems, so there's moving mechanical parts like mirrors that oscillate back and forth to move a laser beam across the probe. And there's some speeds that are reported, 3.5 frames per second and for the Optiscan, and 12 frames per second for the Cellvizio. I would say that at a decent speed, I mean, if you think about your computer's refresh rate, that's about 50 to 60 hertz. So 50 to 60 frames per second. I think that's a pretty decent benchmark, your computer's refresh rate. I think 3.5 and 12, it's a bit low. So units have started to get smaller, like this one we've constructed here. This is this unit we've designed for outreach, but it's similar to one you would want to see by the bedside. It's small, it's portable, it's low cost. It uses LED illumination, which is usually lower cost than lasers. And it's quite portable, whereas you think about a big laboratory microscope, they're not portable. So there is a tendency towards smaller units just for practical considerations. There's also research being done out of, I know, Rice University in Houston, and I'm sure there's other ones that are bringing these small portable units into the field and doing real-time diagnosis of oral cancer, cervical cancer. And that means these communities that may not have had the diagnosis are now getting the diagnosis and getting straight into treatment. So while the benefits of endomicroscopy are clear, translating the technology to the field seems to have been more clunky. If you have a look at these sets of images, now this came out of the Journal of GIE. I think it's gastroenterology. I'm not sure. The top images, those are conventional histologies, and the pink and purple contrast agent, that's a stain known as H&E. It's really widely used, and all it's meant to do is to differentiate things that are important and countable from things that aren't, the more the background. So in fluorescence, we need to kind of reproduce those effects, and what we do is we use fluorescent contrast agents. So where in the top slides your staining agent is H&E, in the bottom side your staining agent might be methylene blue or acroflavin. Now all those are is fluorescent staining agents, so they bind to features of interest. In the case of acroflavin, it binds to proteins, and that'll then show up in fluorescence images. So the transition that needs to happen is there's a training gap from clinicians who are used to interpreting H&E slides like above to being able to get the same information out of fluorescence images. And one other thing I want to note is the markers are changing in fluorescence endomicroscopy images. Where you might have looked at tissue morphology in the top images, you may look for more cellular level indicators like nuclear crowding or cell wall thickness. So as you can see, looking at a conventional histology slide, what I've done is I've taken the size of an imaging bundle. They're usually less than a millimeter. They can vary between about 200 microns all the way up to 2 or 3 millimeter diameters. Now, if you look at the size of it, you're not going to be able to get a full view of what's going on in a comparable way to histology. So you really need some way to acquire adjacent images and stitch them together to get some larger image that really represents what a histology image would give clinicians. So here's the system itself. Now what you have is, if you look at this LED in the back, you have a blue LED which projects light through a 4x objective, and all that really does is it demagnifies it. We want a really pencil thin beam to be incident on our fiber bundle. So that blue LED goes through a short pass filter, and what short pass filter does is it filters out it allows the short wavelengths to pass. So high energy light will pass the filter, and that high energy light is then reflected off of a dichroic. And when it's reflected off a dichroic, it's then demagnified again and projected onto the cross-section of a fiber optic bundle. So light translates through the fiber optic bundle in pixelated form. It comes in contact with a sample, like you saw in the first video where you're touching fluorescent lens paper. That light then changes color, so it fluoresces, and returns back through the bundle. It's then demagnified through a long pass filter, so that filters out any reflections from the high energy light and allows the lower energy fluorescence to pass the filter. We then use a tube lens which just magnifies that onto a camera. So, and in the top right hand corner, that is the commercial, or that not the commercial system, but that is the system, the outreach system we've developed. It's really small, portable, low cost, and it was originally developed at Rice University, and that devices like that are currently being used in the field in more rural communities in Botswana. One thing to note is there's no inherent rejection of background light. And I'll get into why that matters in just a minute. So here's what, like I said, the light is projected onto the cross section of a fiber core. Now, the fiber bundle has this core structure. So this is a rectangle cut out of our circular fiber bundle core. And it just shows that although we would like nice circular pixels, the reality is not that. And not only are they not nice and circular, but they're not nicely spatially distributed in like a grid or a really well laid out array. I mean, they were initially fabricated to be laid out in an array, but during the process, the fiber was heated and drawn down to make it really thin, and the array is no longer this nice, doesn't fit a nice grid. So here are what images of non-optically sectioned tissue paper, lens paper, on the left, and optically sectioned. And what you can really see is it's much harder to resolve the individual fibers, and it's much harder to resolve some of the features, like where the junctions between the fibers are less clear in the left image, whereas in the right image, you've removed all that out of background light. And you can see that in like the void periods, where you have like space between fibers. It appears as gray in the left image or light green, and it's black in the right image. So it's much easier to resolve individual fibers. Now, the reason for that, it goes to this idea of optical sectioning. So if you have a look at this staircase here, if we were to look top down, what we'd really want to see is we'd want to see each individual step in focus. Now what we actually see is we see one step at the focal plane of the lens in focus, but the steps above and below out of focus. And the further above and the further below the focal plane, the more out of focus the step is. So that's not very useful when we're trying to get a realistic understanding of what we're actually trying to image. So what we do is we need to come up with a technique to remove the blurred steps, and then adjust the focus through each of the steps, and then merge a final image. And that's what optical sectioning allows us to do. So what we do is we modulate the step by adding information to it, and then we demodulate it to get a nice crisp image with the blurred steps removed. So we'll do that for the focal step. We will then physically move the device you can see there in the camera up and down, and so we demodulate a full set of 5 steps. Now what you see on the left hand side is you see a camera above the stairs, and on the right hand side that's what's known as a digital micromirror device. So it works the same as a movie theater projector. It just projects line pairs onto focus, and out of focus those line pairs blur. And then what we do is we take a total of 3 images where we take the one with the line pairs as they are now. We then physically shift the line pairs 2 pi per 3, and then we physically shift them 2 pi per 3 again. So a third of a period, a third of a spatial period. And then we're able to use this formula to reconstruct the image. So just how that, before I introduce the formula, this is what the line pairs look like when you're on a focal plane on the left where it says focus. And as you start to move away in the Z direction, you're at 2.5 microns away from focus. And you can see those line pairs are no longer crisp. They've started to blur. And once your Z is 5 microns away from focus, you have significantly more blurring. And then the step below shows the spatial period shift that we undergo for our total of 3 images. So, as I said, this is just hammers home the point that if you look at the intensity profile in focus, the blue line, it is much crisper. The black line, the square waves really start to approximate, well, not square waves, the lines start to approximate sine waves, as if we'd projected a nice smooth sinusoidal pattern. And then the red line, there's virtually no modulation. So the difference The greater the peak-to-peak value, the more that's going to be reconstructed when we go to reconstruct our images. So what we do is the first step, this focal plane is modulated by taking the product of the image and this formula here. All that means is we've projected line pairs where F is the spatial frequency, so how many line pairs per stare. M is the modulation depth, which is the difference, roughly speaking, it isn't quite correct, but the difference in the highest peak and the lowest peak. The greater the modulation, where 1 is perfect modulation and 0 is no modulation. The greater the modulation, the greater percentage of that plane will be reconstructed in the final image. Phi is our phase, and that's just that's 0, 2 pi per 3, or 4 pi per 3. So they're either shifted, not shifted at all, they're shifted a third of a period or 2/3 of a period. So this demodulation formula, all that says is take what is different in each of the 3 images, and that's what needs to be reconstructed. What's the same needs to be attenuated. So if you think about it, in all 3 images, I1, I2, and I3, your out of focus light is in the same place. So if you're subtracting the same plus different minus the same plus different, what you end up with is, well, different 1 minus different 2, but the same, the component of I1 and I2 that's the same is subtracted out. So going back to the sine waves, the sine wave, where it's modulated, where the blue line is really pronounced on the intensity profile page, you're going to be reconstructing that plane. You're going to be reconstructing it very well, but where you have really imperfect modulation and it's out of focus and it's blurred, you're not going to be reconstructing that at all. So your final image is only going to have components that are different, so where the modulation is different, the carrier is different. Now there's one cost to structured illumination that a lot of other optical sectioning techniques don't have. And that's noise. It's impossible to perfectly modulate a real system. We can get close, but it's not possible to have perfect modulation. So because of that, your M is never 1. And because your M is never 1, your signal, the intensity of the reconstructed image falls. But the noise, because each of the, so going back to the demodulation formula, I1 and I2 are all made up of some component that is the same and some component that is different. But there's a third component they're made up of, which is noise. So by its very nature, noise isn't in the same place in all 3 images. So when you subtract it out, it's going to be reconstructed. So what you really have is you have your signal that starts to fall during the reconstructions, and your noise remains about the same. So your signal to noise ratio starts to go down. So at this point, I think it's really important to just remember why we're trying to do this. So histology images it's a cumbersome, time-consuming process. And an alternative to histology is endomicroscopy. And these probes can get good images, but it can be difficult to resolve individual features. So we need to use optical sectioning via structured illumination to resolve crisp, clear images. So back to structured illumination. This is how we do it in practice. We project our line pairs using a number of methods. We use something called the digital micromirror device, which is the same technology in just movie theater projectors. It's an array of mirrors where the mirrors are either on or off. And I'll talk more about that in a minute. But this is what it looks like at the fiber bundle's cross-section. So we have the objective, and instead of having an imaging plane where you would put a microscopy slide, we put an imaging bundle. And the imaging bundle translates light in pixelated form. So an image on one side of the bundle is close enough. It ought to be exactly equal to an image on the other side of the bundle. And you can see, looking at the bundle, there's what's called a United States Air Force 1951 resolution target on the other side of the bundle that's being imaged back. We know, because it's a fluorescence system, that there has to be some kind of fluorescent dye on the Air Force target, but this is what it looks like when we project the line patterns onto the bundle. So this is going to get a bit more technical. This is what's known as the axial response profile of the bundle. What this effectively is we have a plane, like a metal plate, and we've colored it with yellow highlighter, and then we've put our bundle in contact with it, and we've moved it away from our bundle at a known distance. And what we really want to know is how quickly does the intensity drop off. So what that's related to is the out of focus light is going to drop off faster with greater optical sectioning. So you're going to have the crisp clear fibers. You don't really want whatever's behind those crisp clear fibers in focus. So the faster that stuff drops off, the better optical sectioning this is. So what you can see in this plot is normalized intensity, distance from focus, and LPW. So that isn't what LPW stands for is line pair width. Those aren't actually measured in spatial units. They're measured in number of pixels on the array of mirrors, the digital micromirror device. Those aren't really useful quantities to know as far as it's system dependent, because we are not reporting values in real space. But so what you can see by this plot, though, is that LPW 12, so a line pair width of 12, meaning 6 black pixels and 6 white pixels, or 6 on, 6 off, they're going to drop off a lot quicker. So if you want more well-resolved fibers, LPW 12 is going to be able to reconstruct everything in contact with the probe, and everything further back will be attenuated. So like I said, the device we use to generate the lines looks like this, and what I'm really showing here is how you optimize these patterns. It depends on the pixel structure of the device. This DMD that we used here, the DLP 3000, has a diamond pixel array, whereas so what you need to do is you need to orient your line pairs at 45 degrees, and that way you don't have any artifacts near the edges. So going back to the schematic, what we've done is we've taken the LED out of the system, and we've put in a digital micromirror device. And by doing that, what we're then able to do is project the line pairs directly onto the fiber optic bundle. And then up top, that shows how we would incorporate this into a boxed system in the top right-hand corner. So once we have the system working, and we want to get mosaics, because the probe just isn't big enough to get faithful representations, especially not if you want to compare them to histology. And if the technique is going to take over the role that histology played, the images need to be comparable. So if you look at what happens when we translate this probe across a sample, well, structured and illumination requires 3 frames to get one reconstructed image. When you have motion, and that motion is parallel, you start to get this blurring. And when you have motion that's perpendicular to the line orientation, you start to get this, you get blurring again and chopping, and these fixed spatial frequency artifacts. You see a lot of repeated features. And those won't allow mosaicking to succeed, and the images are going to look very, blurred and chopped. So we reported some work that allows us to make improvements, and how we've done that is if we know the direction of motion in advance, what we can do is we can modify the 3-frame structured illumination sequence to include 2 fully illuminated end frames. and we can manually fix the patterns parallel to the direction of motion. So what we would then do is we would record the images and determine the motion between the two end frames. And then we would shift the raw images using that recorded motion, and we would reconstruct the image in an overlapping area. I want to show some of the preliminary results we presented at a conference in February. Again, what I will say is this is only true when the motion of the probe is known in advance. This is not true when a probe is just moving in any direction or is in handheld operation. We haven't yet reported that. But this, yeah, so as you can see in the top images, you can't resolve the individual fibers. As you can see in the bottom images, it's a lot easier to resolve the individual fibers. And if you look on the right-hand side at the wide field image, you don't have optical sectioning, but you can still use this correction protocol to get more faithful wide field images. So just to wrap up, conventional histology is limited by the fact that tissue needs to be removed, sliced, and stained, and then examined. There's multiple specialists, and there's equipment limitations, and then you need a good amount of space and infrastructure. So an alternative is the optical biopsy via endomicroscopy, and a portable system like this can be used to image things, but there's no inherent optical sectioning. Optical sectioning can be added using structured illumination microscopy, where line pairs are projected onto the focal plane. And those are used to reject the background light when the images are reconstructed. Problems happen because this is a 3-frame acquisition process. Any motion between the 3 frames leads to artifacts, and the hope is, with a few more improvements in the motion compensation, you would be able to reconstruct artifact-free structured illumination images that make the way towards high-speed mosaics. And I want to give a big thank you to my supervisor, Mike Hughes, and the entire Applied Optics group here at the University of Kent. Thank you.